allergy هي المفروض ألوس اللي هو أثر يرجو إن هو work or energy. الألرجي المفروض إن هي عبارة عن an altered reaction of the tissue of certain individuals caused by exposure to an agent which أو that are innocuous to other persons، يعني المفروض إن هو غير مؤذي لبعض الناس التانية. And these reactions are usually unpredictable غير متوقعة and occur only in some individuals and result after prior sensitization or exposure. هي المفروض إن الألرجي بتبقى عبارة عن abnormal response to the innocuous environmental allergen. الألرجين دوت المفروض إن هو عبارة عن antigen that cause an allergic immune response. الأنتيجين دوت هو بيبقى a substance which is able to provoke a specific immunologic response mainly the production of antibodies. والمفروض إن الأنتيجين بتبقى عبارة عن substance composed of large molecules which are usually protein and sometimes بتبقى maybe polysaccharides. المفروض إن the majority of the drugs consist of molecular weight less than 1000 and which alone are unable to act as antigen. ففي الحالة دي بيسموها pro antigen أو بيسموها هابتن. When an individual become hypersensitive to drugs زي مثلا الأسبرين, it's believed that the aspirin react with the body protein. فبالتالي الأسبرين body protein conjugate لو بنقول عليه دلوقتي الأسبرين body protein conjugate ده بنقول عليه الأنتيجين. والهابتن in this case اللي هو الأسبرين which confers specificity on antigen. فبالتالي production of antibodies which react only with aspirin or to some closely related chemicals compounds while the protein confer antigenicity. في كمان عندنا الانتيبوديز دي هي بتبقى عبارة عن proteins produced by the body in response to the presence of an antigen and those involved in the drug hypersensitivity appear to be of two main types. في عندنا نوع من أنواع الانتيبوديز serum antibodies وفي antibody associated with lymphoid tissue. بالنسبة للسيرم antibodies هي المفروض are produced by plasma cell تبقى found principally in the lymph nodes ممكن كمان also present in the spleen and bone marrow and then leave them to become part of the gamma globulin fraction of the plasma protein. One group تبقى known as reagents or reagenic antibodies المفروض إن هي بتبقى has special property of attaching themselves to specific tissue. When an antigen encounters specific cell-bound antibody اللي هو بنقول عليه reagent فالantigen antibody interaction take place which involve those cells to which the antibody is bound with the result of cellular damage occur and accompanied by release of the pharmacological active substance from within the damaged cell. هي بقى الفارماكولوجيكال active substance اللي بتطلع من الدامج cell ديت. في عندنا الهستامين slowly acting substance وفانافلاكس وفي كمان الهيدروكسي تريبتامين والسيروتونين والبراديكاينين. الهستامين المفروض إن هو بيعمل contraction of the smooth muscle dilation and increase the capillary permeability resulting in fall of the blood pressure. والمفروض كمان بيحصل stimulation of the glandular secretion especially those of the oxygenatic cells of the stomach which lead to an outpouring of gastric juice rich in HCl. slowly acting substance اللي هي بتبقى released during anaphylactic shock وبتؤدي إلى slow contraction of the human bronchial muscles. في كمان اللي هو ال 5-hydroxy tryptamine والسيروتونين ده بيعمل stimulation of the smooth muscle and nerve. وفي البراديكاينين وده بيعمل برضه slow contraction of the smooth muscle and vasodilation which increase the capillary permeability and also stimulate the sensory nerve ending to produce the pain. النوع الثاني من الانتيبوديز اللي هي الانتيبودي associated with lymphoid tissue. وهنا reactions to the drugs which belong to this type are mediated by sensitized cells اللي هي lymphocytes and by mechanism المفروض ان هو doesn't involve the serum antibodies. ازاي نمنع drug hypersensitivity reaction or prevention of the drug hypersensitivity reaction. المفروض it's impossible to eliminate the risk, but careful attention to certain points should help to reduce their incidence. أول حاجة إن the patient should be questioned about any previous abnormal response to particular agent concerned. ثاني حاجة patient with allergic disease are more liable to exhibit drug hypersensitivity and to suffer from severe reaction if they occur. Patients كمان with history of high fever, asthma must be taken as warning signs of increased susceptibility. Drugs كمان should not be administered intravenous when intramuscular or subcutaneous route is adequate. Oral route is most likely to be the safest, while intravenous route is the most dangerous. فيعني ما بنحبش إن احنا ندي حاجة intravenous نديها oral. إذا ما كانش ينفع ممكن intramuscular or subcutaneous. When any drug is injected into the patient liable to exhibit hypersensitivity, he should be kept under observation for 30 minutes because serious reactions are most likely to occur during this period. كمان the dentist or dental surgeon must always be ready and equipped to deal with this type of emergency. يعني تعرف ازاي تتعامل مع emergency دي. And when a patient is found to be hypersensitive to drug, it's important that he should be informed of the fact. الدراجز بقى اللي هي بتبقى used to treat the hypersensitivity reaction في عندنا sympathomimetic amines، في الكورتيكوستيرويدز وفي الانتي هيستامينز. السيمباثومايميتيك amines ودي اللي هي الادرينالين بتعمل له injection يا اما subcutaneously or intramuscular بيبقى 0.5 millimeter of 1 per 1000 concentration. لو 1 على 1000 concentration of adrenaline بتاخد نص ملي subcutaneously or intramuscular و repeat every 5 minutes بحيث ان الماكسيمم دوز تبقى 1.5 ملي. never inject الادرينالين intravenous لان لو اتعمل injection ليه intravenous it will produce ventricular fibrillation. والادرينالين يعتبر هو first line of emergency in the anaphylactic shock since it is a vasopressor bronchodilator. في كمان الكورتيكوستيرويد اللي هو الهيدروكورتيزون صوديوم ساكسينيت بيتاخد بدوز 100 ملي جرام intravenous or intramuscular. والمفروض الكورتيزون is the drug of choice in emergency. بتبقى used when rapid effect is required زي مثلا في حالات الانافلاكتيك shock. It doesn't prevent antigen-antibody interaction. هو الكورتيزون ما بيمنعش antigen antibody interaction ولكن هو بيبقى act by protecting the cells from the outcome of the immunologic reaction. يعني بيحمي السيلز من التأثير بقى بتاع أو اللي هيحصل من الاميونولوجيك رياكشن. الأنتي هيستامين دي بتبقى acting only against histamine زي مثلا البوميثافين HCl بيتاخد بدوز 25 ل 50 ملي جرام اورالي او intramuscular وده بيبقى long acting بيبقى بيقعد حوالي من 20 ل 24 ساعة وبيبقى highly sedative with highly sedative effect. بيبقى ممكن بيبقى حوالي السيداتيف effect بيبقى من 8 ل 12 ساعة بس taken at night. كمان غير البروميثازين HCl في الميبرامين تابلت، ده بيبقى 50 مللي جرام، ممكن بيتاخد 100 ل 200 مللي جرام per day in divided dose. وفي البايريدين زامايد تابلت، ده برضه 50 مللي جرام 1 or 2 tablets 3 or 4 times per day. هو المفروض نيجي بقى لنوع أو types of the allergic reaction. هو المفروض الallergic reactions دي بتبقى two main types، في immediate وفي delayed. In the immediate type the clinical effects appear relatively soon after the exposure to the antigen. ودي زي مثلا في حالة الانافلاكتيك shock and usually characterized by release of pharmacologically active substance. كمان it is associated with a high level of circulating antibodies in the bloodstream, and this level is high enough to be demonstrated in vitro by antigen antibody precipitation technique. يعني بحيث ان الانتيبوديز يقدروا ان هم يحددوا وجودها بتست معين او بريسبيتيشن تكنيك او antibody precipitation technique زي investigation كده. في كمان atopic hypersensitivity diseases زي الهاي فيفر، الارتكاريا، الأزمة، angiotic edema. دي بتبقى types of immediate hypersensitivity reaction and show a familial distribution. كمان بيبقى فيه increased susceptibility to the hypersensitivity state. الانتيجين بيبقى usually in the form of ممكن grass, pollen, egg, house dust, bacteria and fungi. في الatopic type or type of hypersensitivity reaction المفروض ان circulating antibodies can be detected only by a delicate mechanism in which the serum from the sensitized atopic person is injected subcutaneously into the tissue of normal person. A specific allergen is then introduced into this same site after a lag of time about 24 hours. A local will develop indicating positive reaction. And this demonstrates اللي بنقول عليه antigen antibody union, and the development of the will is due to the local increase in the capillary permeability due to release of the pharmacologically active material. ده بالنسبة للإميديت hypersensitivity reaction. النوع التاني اللي هو delayed hypersensitivity reaction، وده بيبقى different from the immediate type in that the delayed type classically doesn't produce a clinically detectable effect for several hours and tend to reach maximum between 24 to 48 hours. يعني ممكن في 24 ساعة أو يومين ممكن يبدأ يظهر الماكسيمم effect. This is a clear distinction to the immediate lesion which occurs shortly after introduction of the allergy. وده بيبقى الفرق ما بين immediate lesion أو lesions of the immediate hypersensitivity reaction. Circulating antibodies كمان cannot be detected in the serum neither by direct in vitro precipitation method nor by the more sensitive passive transfer technique اللي احنا قلنا عليه في immediate hypersensitivity reaction. كمان بيبقى فيه successful passive transfer has indeed been achieved in the human, but it has involved transfer of cells of the lymphoid cells not in the serum. والمفروض ان السوماتات في الناتا is an example of the delayed hypersensitivity reaction. كده المفروض ان هما ان two main types of the allergic hypersensitivity reaction. بس هما المفروض ليها classification تانية اللي هي comes and J classification. بيقسموها إلى type 1 ده بيبقى immediate بيسموه atopic or anaphylactic hypersensitivity reaction. في كمان type 2 ده بيقول عليه antibody dependent reaction. في type 3 ده بيبقى immune complex hypersensitivity reaction. وtype 4 ده بيبقى cell mediated or delayed hypersensitivity reaction. بالنسبة لtype 1 hypersensitivity reaction هو المفروض it's also known as immediate or anaphylactic hypersensitivity. The reaction may involve السكين وفي الحالة دي بيؤدي إلى urticaria أو إكزيما. ممكن يأثر كمان على الآي، بيؤدي إلى conjunctivitis، بيأثر كمان على النيزوفارينكس وممكن يعمل رينوريا أو رينايتس، وممكن يأثر على البرونكو بالمونري تيشو بيعمل أزمة، ممكن كمان يأثر على gastrointestinal tract ويعمل gastroenteritis. هو المفروض إن الرياكشن دوت may cause a range of symptoms ranging from minor inconvenience symptoms to death. يعني ممكن تبقى حاجة very mild أو ممكن تبقى so severe لدرجة إنها تؤدي إلى death. الرياكشن دوت يبقى usually take 15 to 30 minutes from the time of exposure to the antigen. في بعض الحالات ممكن أو sometimes it may be أو it may have a delayed onset، ممكن يبقى 10 to 12 hours. The immediate hypersensitivity reaction المفروض إنها بتبقى is mediated by the IgE antibody. The serial or the primary serial component in this hypersensitivity is the mast cells or basophils, and the reaction is amplified and or modified by the platelets, neutrophils and eosinophils. عادة لو بيعملوا biopsy مثلا of the reaction site فالمفروض إن هي demonstrating mainly mast cells and eosinophils. الميكانيزم بيحصل إزاي؟ هو المفروض إن mechanism of the reaction involves the production of IgE in response to certain antigens أو allergens. والمفروض إن ال IgE دوت بيبقى has very high affinity for its receptors on the mast cells and basophils. لما بيحصل بقى بعد كده subsequent exposure to the same allergen فده بيؤدي إلى cross the links of the أو cross links the cell bound IgE and it triggers أو stimulates the release of the various pharmacologically active substances. When cross linking of the IgE C receptor that is important in the mast cell triggering. الماست cell degranulation بتطلع بقى كل الفارماكولوجيكالي active substance اللي بتبقى فيها بتبقى is preceded by increase in the calcium influx which cause a crucial process بنسميها ionophores which increase the cytoplasmic calcium and also promote the degranulation where agents will deplete the cytoplasmic calcium influx and this will suppress the degranulation. المفروض ان الماست سيلز ديت ممكن كمان يحصل لها triggering by other stimuli such as exercise emotional stress. ممكن كمان chemicals زي الفوتوغرافيك developing medium أو calcium ionophores أو الكوديين أو ممكن الأنافيلاوتوكسينز اللي هو بنقول عليها activated complement 4 و 3 و 5. كمان الرياكشن ديت بتبقى are not hypersensitivity reaction also they produce the same symptoms. في بعض examples اللي هي بتبقى for type 1 hypersensitivity reaction زي الانافيلاكسيس زي allergic asthma زي allergic conjunctivitis allergic rhinitis أو اللي هي fever angioedema and urticaria. نيجي بعد كده التايب 2 hypersensitivity reaction ده بيبقى is also known as cytotoxic hypersensitivity and may affect a variety of organs and tissue. والمفروض هنا the antigens are normally endogenous Also exogenous chemicals كمان may lead to this type of hypersensitivity اللي بنقول عليها الانtigens which can attach to the cell membrane and can also lead to type 2 hypersensitivity زي مثلا في حالة drug induced hemolytic anemia أو granulocytopenia أو thrombocytopenia. هنا الدراج بيؤدي إلى destruction of the red blood cell أو granulocytes or thrombocytes. الرياكشن ده المفروض إن هو بياخد وقت قد إيه أو في time بيبقى minute to hour. المفروض إن type 2 hypersensitivity reaction is primarily mediated by antibodies of IgM or IgG classes and complement lymphocytes and natural killer cells are play an important role. بيشخصوه ازاي؟ المفروض ان هو بيتعمل detection of the circulating antibody against the tissue involved and the presence of antibody and the complement in the lesion أو لو عن طريق biopsy by immunofluorescent test. examples اللي هي type 2 hypersensitivity reaction اللي هي autoimmune hemolytic anemia, pernicious anemia, immune thrombocytopenia, transfusion reaction, Hashimoto's thyroiditis, Graves' disease, myasthenia gravis, إلى جانب كمان hemolytic diseases of the newborn. في بعد كده hypersensitivity أو type 3 hypersensitivity reaction وده بنسموه كمان أو also known as immune complex disease occurs when the immune complex اللي بيبقى نتيجة antigen antibody reaction are not removed from the circulation and these complex are deposited in various tissues and organs such as kidney, joint, lung, skin. Immune complex formation may occur as a result of autoimmune disease or persistent infections like hepatitis virus or repeated inhalation of the antigenic material. فهو بيحصل steps بيبقى step 1 بيحصل بيبقى فيه large quantities of the cerebral antigen antibody complex in the blood and are not completely removed by the macrophages. These antigen antibody complex lodged in the capillaries between the endothelial cells and basement membrane, where this antigen antibody complex activates the classical complement pathway leading to vasodilation, where بيحصل إن complement proteins and the antigen antibody complex attack the leukocytes to the area. Leukocytes yet تعمل discharge their killing agents and promote massive inflammation and this lead to tissue death and hemorrhage. According to the size of the immune complex, time, place, بتعمل determination if the reaction will occur or not. Yearly in the response there is little antibody and excess of antigen وده بيؤدي إلى small immune complex are formed that don't fix complement and are not cleared from the circulation. The intermediate stage in the response بيبقى في comparable amount of antigen and antibody when immune complex are formed and can fix the complement and cleared from the circulation. Later on in the response there is large amount of antibody and little antigen when the immune complex of intermediate size are formed and can fix the complement and cleared from the circulation. Localized deposits of the immune complex within the tissue تؤدي إلى type 3 hypersensitivity reaction. ممكن تبقى locally injected antigen in human individual with IgG antibody أو يبقى في local immune complex formation بعد كده يحصل activation of the complement and release of the inflammatory mediators والactivated complement بقى 5, 3, 4 كده also induce mast cell degranulation وبيؤدي في الآخر إلى local inflammation movement of the fluid and protein into the tissue and blood vessel occlusion. Examples of these diseases اللي هي بتبقى caused by this immune complex زي systemic lupus erythematosus زي البولي arthritis nodosa أو ممكن كمان البوست streptococcal glomerulonephritis والسيرم sickness. systemic lupus erythematosus وده المفروض بيبقى عبارة عن disease characterized by the presence of autoantibodies which form immune complex from with the antigen and deposits within the kidney glomeruli and the resulting type 3 hypersensitivity is responsible for the glomerulonephritis in this disease. بيحصل inflammation of the blood capillary vessels within the glomeruli فبيبقى clinically أو clinical pathologic manifestation بيبقى فيه arthritis, vasculitis وده بيبقى بسبب الأنتيجين involved DNA nucleoprotein and acid. في البولي arthritis nodosa بيبقى بيحصل vasculitis بالأنتيجين بيبقى اللي هو الهيباتيتس بي فيروس surface antigen وفي post streptococcal glomerulonephritis بيحصل كمانيفستيشن nephritis والانتيجين involves the streptococcal cell wall antigen وفي serum sickness بيبقى في arthritis, vasculitis, nephritis وهنا الانتيجين involve various proteins. في كمان غير السيستميك lupus erythematosus والسيرم sickness والimmune complex glomerulonephritis في كمان rheumatoid arthritis, subacute bacterial endocarditis و symptoms of malaria and ulcers reaction. نيجي type 4 hypersensitivity reaction وده بيبقى also known as cell-mediated or delayed hypersensitivity reaction or delayed type hypersensitivity reaction وبيبقى the classical example of this hypersensitivity is the tuberculin reaction. فهنا بيحصل reaction takes 48 hours after the injection of the antigen and the lesion is characterized by induration and erythema. في type 4 hypersensitivity reaction is involved in the pathogenesis of many autoimmune and infectious diseases like tuberculosis, leprosy, blastomycosis, histoplasmosis, toxoplasmosis, and granulomas due to infection and foreign antigen. في another form of delayed hypersensitivity reaction هي contact dermatitis بتبقى lesions هنا بتبقى more popular والمفروض ان type 4 hypersensitivity reaction can be classified into 3 categories depending on the time of onset and clinical and histological presentation. بتتقسم إلى contact type, tuberculin type and granuloma type وعلى حسب الرياكشن تايم في الكونتاكت تايب بيبقى ما بين 48 ساعة ل 72 ساعة والكلينيكال برزنتيشن بتبقى في صورة إكزيما بينما في التوبركلين تايب بيبقى من 8 الرياكشن تايم بيبقى من 48 برضه ل 72 ساعة بس بيبقى فيه لوكال انديوريشن وفي الجرانيولوما تايب بيبقى الرياكشن تايم ما بين 21 ل 28 يوم وكلينيكال بيبقى فيه hardening of the tissue. هنا الميكانيزم بيبقى include T lymphocytes and monocytes and or macrophage. المفروض إن cytotoxic T cell cause direct damage where the T helper cell secrete cytokines which activate the cytotoxic cells and recruit and activate monocytes and macrophages which cause damage. Delayed hypersensitivity reaction بتبقى mainly contain أو lesions يعني بتبقى mainly contain monocytes with few T cells. والdiagnosis test تبقى in vivo including delayed cutaneous reaction اللي هو المونتاكس test in vitro test for delayed hypersensitivity reaction include mitogenic response, lymphocytotoxicity and interleukin 2 production. Corticosteroids and other immunosuppressive drugs are used in the treatment of this type of hypersensitivity reaction. وفي بيبقى example ليها اللي هي contact dermatitis symptoms of leprosy or tuberculosis and transplant rejection. Anaphylactic shock. كلمة anaphylaxis means unprotectedness. والanaphylactic shock دي تعتبر أو it is the most dramatic and dangerous reaction which follow administration of a foreign protein or drug to which the subject has become sensitized. Clinically بيبقى هي بتبقى دايما usually started with flushing and itching of the skin, and this is followed by severe difficulty in breathing due to laryngospasm and bronchospasm and severe fall in the blood pressure. The pulse is rapid and weak and may almost unpredictable. ما تقدرش حتى ان انت تحسه. Condition may be rapidly fatal unless immediate steps are taken to administer adrenaline. والمفروض in the earlier the onset of the symptoms following the injection, the more severe and dangerous the reaction is likely to be. يعني كل ما كانت السيمتومز بتظهر بدري قوي بعد الانجكشن مثلا او الدراج او whatever او الانتيجين فده بيؤدي الى ان يبقى في more severe and dangerous reaction. المفروض ان the dangerous reaction are rare after the first 30 minutes, and for this reason try to keep the patient under observation for half an hour after any injection. يعني المفروض ال dangerous reaction دي بتبقى rare انها تحصل في ال 30 minutes الاولانيين او 30 دقيقة الاولانيين وعشان كده بيقول لك لازم keep the patient على الاقل لمدة نص ساعة after injection يبقى keep under observation. The principal disturbance is attributed to ايه السبب اللي بيخلي الsymptoms تظهر بالشكل دوت؟ بيحصل damage to the endothelial lining of the blood vessel which increase the permeability and dilation. بيحصل كمان spasm of the smooth muscle of the bronchial tree والمفروض الادرينالين act as a physiological antagonist to these effects by virtue of its vasoconstrictor and bronchodilator action, and so opposes this potentially lethal action caused by the histamine and other pharmacological active agents released during the anaphylactic reaction to the drug. In treatment, المفروض طبعا patient should be placed horizontally either by appropriate adjustment of the dental chair or by placing him on the floor. If respiratory depression is present, فالمفروض oxygen should be administered or mouth-to-mouth respiration is given ideally by means of proximal airway. patient كمان المفروض بياخد ادرينالين باي انجكشن بيبقى نص ملي اللي هو 1/1000 ادرينالين injected by intramuscular route followed by hydrocortisone 100 milligram by intravenous route. ممكن كمان في further dosage of adrenaline can be given as required at interval of 5 minutes يعني على حسب الحالة محتاجة ولا لا أو على حسب السيمتومز بيحصل لها subside أو resolution ولا لا ممكن بتديله جرعة تانية من الأدرينالين بعد 5 دقايق until the symptoms being to subside. الماكسيمم دوز اللي ممكن ياخدها من الأدرينالين بتبقى 1.5 ملي over a period of 15 minutes. Avoid intravenous adrenaline injection because the intravenous adrenaline injection will produce ventricular fibrillation اللي هو بيقولوا عليه الارتجاف الأذيني ماشي. Corticosteroids are anti-allergic agent. It doesn't prevent the antigen-antibody interaction ولكن it acts by protecting the cell from the outcome of the immunologic reaction. الانتيهستامينز بياخدها البيشنت تبقى عادة تبقى ineffective alone in the treatment of the anaphylactic shock because histamine is only one of the pharmacological active agents released. في other mediators بتطلع not recognized by the antihistamines. كمان these drugs can be best restore the vasomotor tone to its original state. ده بالنسبة للأنافلاكتيك شوك. في كمان عندنا الهاي فيفر ودي بتبقى عبارة عن recurrent form of allergy to wind-borne pollen of grasses and trees or to the ingestion of certain foods. لو يعني تقريبا بالعربي بيقولوها حمى القش. It appears to be a familial predisposition to allergic manifestation. It has a seasonal instance, particularly in the early summer. The symptoms of the high fever بتبقى في itching of the nose with profuse watery nasal discharge. يبقى في watery discharge من النوز. كمان بيبقى في paroxysm of sneezing and coughing. في conjunctival irritation and lacrimation وبيبقى في كمان headache and depression. These symptoms are due to the marked congestion of the mucous membrane of conjunctiva and upper respiratory tract passage. Treatment المفروض patient should avoid contact with the causative pollen agent. patient ده المفروض بياخد antihistamines. Antihistamines relieve these symptoms. Steroid كمان may be given in cases refractory to the antihistamines. يعني إذا ما الانتيهستامين ما جابتش نتيجة ممكن بياخد الستيرويد. في كمان specific sensitization could be done as a prophylactic measure and should be started several weeks before the pollen season. And this may have to be repeated yearly. يعني حاجة كده زي شبيهة بالتطعيم كده يعني ياخدها قبلها قبل الفترة اللي هي بيجيله فيها الهاي فيفر ديت وبياخدها أو بيعيدها كل سنة. في عندنا كمان الأزمة ديت هي بتبقى عبارة عن allergic disease characterized by recurrent attack of acute breathlessness يعني مبقاش قادر ياخد نفسه. The patient is abnormally sensitive to various substances inhaled or ingested and dental foci may aggravate the condition. هو ايه اللي بيحصل في البرونكيال asthma دوت؟ هو بيبقى فيه اللي بيحصل intense spasm of the smooth muscle of the wall of the bronchi, the swelling of the bronchial mucosa, and there is exudate of mucus. The exudate of mucus دوت will interfere with the flow of air during inspiration and expiration. فكلينيكالي الكلينيكال فيتشر هتبقى عبارة عن ايه؟ بيبقى الأتاك ديت هي sudden onset and short forceful inspiration aided by accessory muscles of respiration followed by longer easily healed breathing expiration. يعني بيبقى sudden onset فجأة ياخد نفسه جامد قوي مدة قصيرة الانسبيريشن بعد كده الاكسبيريشن ده بحيث ان هو ويزنج يعني اللي هو زي ما يبقى واحد عنده صوت دور برد مثلا كده وهو بياخد نفسه وبيطلعه تحس فيه زي تزييق كده ده بنقول عليه اللي هو هي ويزنج الاكسبيريشن. Expiration is not successful in deflating the chest which become distended and fixed in position of full inspiration and the face is puffy, patient is anxious and the lips, ear, nose, and extremities are cyanotic. Attack lasts for half an hour to several hours and very prolonged attacks في الحالة ديت بيسموها status asthmaticus. If the asthmatic attack occurred in dental office فالمفروض بقى ايه هي البروسيجر اللي should be followed. Stop the dental procedures. Check that the airway is clear. Loosen tight closing. Permit the patient to sit upright. يكون في upright position. Ensure the atmosphere in the room is airy and cool. Some patients may carry some remedies for self-medication. بيبقى معاه حاطط في جيبه أو حاجة الميديكيشن بتاعته. If so, the dentist have to utilize it. فبيبقى فيه مثلا pressurized aerosol containing isopropylene or adrenaline for inhalation. وفي كمان ممكن يبقى معاه isopropylene tablets for sublingual use. بتبقى تابلت 20 مللي جرام. أو ممكن يبقى عن طريق subcutaneous injection of 0.5 to 1 millimeter of 1 per 10 adrenaline أو 1 على 10 adrenaline بيتعمل له injection بدوز نص ال1 مللي جرام. In severe prolonged attack بيحتاج في الحالة ديت oxygen inhalation مع intravenous aminophylline or steroid and sedation should be administered. في عندنا كمان الارتكاريا. والارتكاريا ديت المفروض ان هي عبارة عن common allergic reaction of the skin varying from small localized papules to extensive coalescing plaques involving large area of the body. It's due to a variety of factors such as food, drugs, or bacterial infection. Bacterial infection of dental interest المفروض ان هي ليه مهمة؟ لان البكتيريال infection of the teeth and the throat تعتبر important cause of the chronic urticaria. The mechanism mediated by the histamine and related chemicals which released during the antigen antibody conversion. يعني سببها ايه؟ سببها الهستامين أو السبب الهستامين والchemicals produced due to the antigen antibody reaction. As a result of vasodilation بيحصل فيه local erythema and urticaria will develop. في عندنا كمان الانجينيريتك إديما. Angiogenic edema is an attack of circumscribed non-inflammatory edema which involves the skin and subcutaneous tissue and also the mucous membrane anywhere in the body. include إن هو بيبقى فيه two forms of angiogenic edema في hereditary form and non-hereditary form. Hereditary form is rare as the affected individuals are highly susceptible to laryngeal edema as a result of the lesion which have leading to ممكن تؤدي إلى death from the respiratory obstruction. The more common non-hereditary type بيبقى closely resemble urticaria in that they may be precipitated by drugs, food infection or emotional stress. The mechanism of angiogenic edema and بيحصل development of swelling appears to be vasodilation through brought about by release the histamine or histamine-like substance with subsequent translation of plasma in the subcutaneous connective tissue of the skin and submucosal connective tissue or various parts of the body. يعني هو بيحصل release of histamine and histamine like substance وبيبقى فيه vasodilation brought about throughout the body. Clinically or clinical feature there is rapidly developing edema which appears usually in less than half hour and may last over several days. There is severe edema in the face around the eyes, chin, and lips, and may lead to facial disfigurement. Also, there may be swelling of the tongue. ممكن كمان بيحصل blood glands may be enlarged, and the swelling appears smooth, diffuse, painless, with no change in the color or temperature of the affected part. Swelling of the nasopharynx and larynx may produce respiratory emergency. Treatment by relief of abdominal immediate relief of the swelling, particularly if the larynx is involved, بيبقى by subcutaneous injection of adrenaline. الأدرينالين ده اللي هو بيبقى احنا الألف أدرينالين بيبقى نص 1 ملي. and if the adrenaline fails فالمفروض بيتعمل emergency tracheotomy may be life saving يعني زي بيعملوا فتحة كده في اللي هو القصبة الهوائية أو التركية. المفروض if the attack بتبقى less severe فممكن بيتعمل intramuscular injection of antihistamines اللي هو البروميثازين 25 to 50 milligram followed by adequate oral dosage. في عندنا كمان serum sickness syndrome. Serum sickness syndrome ده بيبقى follows the injection of foreign serum. There's a delay of 7 to 10 days before the onset of illness. During this period, the antibodies are produced and will react with the residue of the serum, which is still circulating in the blood, forming antigen-antibody complex. And this complex appear in the general circulation. At the same time the subject develop يعني once الانتيجين antibody complex بتظهر في السيركوليشن بيبدأ بقى البيشنت اللي هو هيحصل له سيرم سيكنس سيندروم دوت تظهر عليه بقى أعراض إن هو يبقى في عنده itching followed by urticarial rash, fever وgeneralized lymphadenopathy. ممكن كمان بيحصل في swelling of the joint أو Allergy, edema of the face, hand and feet, and this is accompanied by asthma or rhinitis. التريتمنت المفروض إن هو بياخد corticosteroids. Corticosteroids it can control all the manifestation and is a drug of first choice. Those urticarial and edematous lesions respond to antihistamines. ولكن ما بيبقاش طبعا ليه افكت على الفيفر ولا الارثرالجيا اللي موجودة. في عندنا كمان حاجة اسمها سيرم accident. السيرم accident دوت هو المفروض بيبقى عبارة عن extremely severe and sometimes fatal reactions that develop in highly sensitized person on administration of foreign serum. بتبقى basically anaphylactic shock والtreatment بتاعتها بتبقى anaphylactic shock. في عندنا بعد كده stomatitis medicamentosa and stomatitis venomata. المفروض stomatitis medicamentosa are eruptive lesions of the oral mucosa resulting from allergic reaction to the systemic medications such as penicillin, barbiturates, antihistamines, sulfonamides and so on. بينما stomatitis venomata بتبقى عبارة عن allergic reaction of the oral mucosa to local contact with a foreign substance or allergen. أنا في فروقات ما بين أو important features أو difference between stomatitis medicamentosa and stomatitis venomata. في stomatitis medicamentosa بيبقى الcausative agent بيبقى systemic medication هذا بيبقى توبيكال. الميكانيزم هنا بيبقى في الاستوماتايتس ميديكامنتوزا بيبقى due to systemic absorption، بينما في الاستوماتايتس فيناتا بيبقى due to local contact with the tissue. من حيث السايت of the lesion في الاستوماتايتس ميديكامنتوزا ممكن anywhere on the body، بينما في الاستوماتايتس فيناتا بيبقى only at the site of contact. ومن حيث السايت of sensitization هنا في الاستوماتايتس ميديكامنتوزا بيبقى active in certain vascular network ساعات بيقولوا عليها fixed drug eruption، بينما في الاستوماتايتس فيناتا بيبقى resulting from sensitization of the epidermis. الdiagnostic aids في الاستوماتايتس ميديكامنتوزا withdrawal of the drug يؤدي إلى symptom relief، وممكن يتعمل small test dose في الحالة ديت السيمتومز هنا والأوجير، وبيقول عليه هنا الباتش تيست is negative، بينما في الاستوماتايتس فيناتا بيبقى الباتش تيست is positive. هو المفروض الباتش تيست دوت هو بيبقى عبارة عن small test dose لما بيحطوا الحاجة اللي هي شاكين إن هي بتعمل allergy للبيشنت أو كده، فالمفروض السيمتومز بتظهر. فهو الباتش تيست help identifying which substance may be causing a delayed allergic reaction in the patient. فهم بيجيبوا يعني الحاجات اللي هي تؤدي إلى الالرجيك رياكشن وبيحطوها على يعني اللي هي بتتحط على ظهر البيشنت، وبيحطوا كذا حاجة مع بعض بقى، سواء كانت كيميكالز أو anti microbial agent أو whatever، حاجات كتيرة، الرابر، الليزر، ممكن pharmacological agent أو medicine، food drink، الكلام ده كله بتتحط كده كأنها في الآخر بتدي زي صورة البلاستر كده اللي هو بتاع الجروح اللي احنا بنحطه. ده طبعا بتبقى فيها بنقول عليها باتش كده، بتبقى الباتش ديت فيها الماتيريال اللي هم عايزين يشوفوها أو يشوفوا إن هي بتعمل ألرجي ولا لأ، وبيسيبوها المفروض لفترة معينة. بتبقى المفروض الباتش ديت stay in place and stored for at least 48 hours. بعد كده بنشوفوا بقى later on بنشوفوا هل بيشيل الباتش ديت هل في حصل allergic reaction or not. المهم هنا عندنا إن اللي بيبقى في البوزيتيف بارت الباتش تيست ده البوزيتيف بيبقى هي الاستوماتايتس فيناتا نوت الاستوماتايتس ميديكامنتوزا. الاستوماتايتس ميديكامنتوزا ديت هي بيبقى فيه there are wide varieties of drugs that may provoke an allergic reaction of the oral mucosa, and the response may range from slight erythema, physical erosion, ulceration, or marked edema that may interfere with the normal function of the oral cavity. والمفروض إن allergic manifestations are not specific for particular drug. يعني ممكن one drug may provoke one type of lesion in a patient and entirely different reaction in another. ممكن الدراج يعمل reaction مختلف ما بين أو يختلف ما بين patient والتاني. Also in the same patient the response to the drug may be diversified. المفروض كمان إن الاستوماتايتس ميديكامنتوزا is almost always accompanied by dermatitis medicamentosa. The onset of eruption is generally abrupt, but it may follow by several hours the administration of the drug. ممكن يبقى suddenly، ممكن يبقى after administration of the drug by several hours. Sometimes the eruption appears at the same site whenever the drug is taken, and this type is known as fixed type of drug eruption. يعني لما يظهر الليجن أو الإرابشن دوت في نفس المكان اللي اتحط فيه الدراج، فده بيقولوا يعني fixed type of drug eruption. Clinically, it may be in the form of erythema, edema, vesicles, or in the form of ulceration. Underlying mechanism of fixed drug eruption is that the drug is being conjugated with therapeutic protein in the vascular bed supplying this particular area. And the tongue is a common site for the fixed drug eruption. بالنسبة للستوماتايتس من الناتا أو بنقول عليها ساعات contact stomatitis هي بتبقى عبارة عن allergic reaction of the oral mucosa to the local contact with foreign substance أو اللي هو الألرجي. And the symptoms of the stomatitis rhinata are often slow in appearing زي كده بيقول عليها delayed being dependent upon the slow antigen antibody reaction and is classified as delayed type of hypersensitivity reaction. Oral mucosal lesions which are established by local contact with substance that normally may be onyx to the other people يعني مش مؤذية للناس التانية may be just a slight erythema or violent ulcerative stomatitis. They may be induced by the dentist or may result from patient use and self-medication. فهي ممكن تبقى induced by the patient caused by dentifrice, mouthwash, dental cleanser أو dental adhesives, chewing gums, lipsticks, lozenges, التروش اللي هي المستخدم كأنيميشن أو الchewing gums كمان with antibiotic or anesthetic agent ممكن بتضاف الانتيبيوتكس أو anesthetic agent دي الchewing gum بتبقى برضه كل الحاجات دي بتبقى used by patient as self-medication for كمان sore throat or pharyngitis and laryngitis. ممكن كمان الفود تؤدي إلى allergic reaction by direct contact. كمان الفلوring والantiseptic والcoloring preservatives in the mouthwash ممكن برضه بتؤدي إلى stomatitis rhinata. Oral mucosa may become sensitized to topical application of the antibiotic used in the form of lozenge. If the topical antibiotic is to be used, the dentist has to prescribe one which is not systemically administered. Iodine or formalin containing preparation ممكن are not tolerated by many patients. First exposure to this material may not only burn the oral mucosa but also sensitize it so that further application of this material will produce allergic contact stomatitis أو اللي هي الstomatitis rhinata. يعني ممكن الفيرست exposure ما يعملش حاجة في الأورال mucosa أو يعمل burning بس ممكن يعمل sensitization للnext exposure أو further application. كمان plastic filling material such as acrylic resin may produce allergic manifestation of the oral mucosa just opposite the filling material. And allergy is mainly due to sensitization of the oral mucosa to the liquid methyl methacrylate أو monomer. كمان severe amount of filling material may also produce stomatitis rhinata, and this is due to sensitization of the oral mucosa to the mercury. في كمان acrylic denture-based material may contribute to the stomatitis rhinata, and this allergic reaction is attributed to either the sensitization of the oral mucosa to the liquid monomer or to the ancillary substance such as plasticizers or the solvents. The residual monomer is more in case of incomplete polymerization of the denture and also in using self-cure acrylic resin as replacing the denture. Denture being and the denture contacting oral mucosa may show the signs of the allergy, and the patient will complain of pain, burning sensation, and the size of the contact. المفروض إن to prove the hypersensitivity to acrylic resin or monomer, it's necessary to perform the patch test اللي احنا قلنا عليه, which can be done on the oral mucosa and the skin also. Testing of the sensitivity of the oral mucous membrane can be performed by covering the palatal surface of the palatal surface of the upper denture with either thin foil or bone foil, or using zinc oxide impression base under a small area so that the denture base material will be in contact with the oral mucosa, and the patient will use the denture as seen at 48-hour interval for examination, if the palatal mucosa opposite the uncovered area show signs of inflammation. ففي الحالة دي التست بيبقى positive. المفروض إن الدنشر contacting mucosa may show the signs of allergic reaction. So if the inner aspect of the lips, cheek, or tongue show some manifestation, this will be as an evidence of the allergic reaction. The dermal test can be done by thermal scraping are taken from the denture and applied to the skin with a small piece of moist gauze. Slit control must be used to ensure that the patient is not hypersensitive to the scraping. يعني بياخدوا كده scratch أو بيعمل scraping للdenture وبيحطوه على السكين وبيحطوا عليه small piece of moist gauze عشان بيتأكدوا إن البيشنت مهواش عنده sensitivity just بس السكرابينج أو الحاجات اللي هي الفوزيات, فبيجيبوا بتعمل على الكنترول تيست على الناحية التانية أو إيده التانية مثلا أو مكان تاني, بيحطوا سكرابينج من نوع تاني وبيشوفوا هل هو hypersensitive ولا لا. المفروض إن to allergy to denture based material is very rare, and in this situation it will was trying a different type of acrylic before moving to that. It's now a difficult and only setting of constructing dentures with porcelain teeth. An allergy to the denture base of precious metals المفروض إن هي has not been reported, ولكن طبعا بتبقى أحسن بدل ما يستعمل بقى اللي هو عشان ما يحصلوش allergy للأكل. Symptoms of psoriasis venenata vary from slight erythema to violent ulcerative stomatitis and cheilitis, and thus the tissue may appear fine red in color, smooth and likely due to tissue edema, and the patient may complain from itching and sensation. ممكن يبقى فيه كمان mild allergic reaction presented as a shallow ulceration, and in severe reaction there is actual tissue necrosis may be observed. And diagnosis بتبقى obtained through the history of contact with a possible sensitizing agent and the site and distribution of the lesion with positive patch test. The treatment بتاعتها by elimination of the causative agent and symptomatic care of the oral cavity depending on the type of the oral lesion. لو في مثلا oral ulceration فبيبقى في مثلا بياخد antiseptic agent is prescribed to minimize the secondary infection. ممكن كمان anesthetic drugs may be prescribed to relieve the pain, and antihistaminic can be done in the early stages. كده المفروض أخذنا types of hypersensitivity reaction وإدينا examples لكل حاجة منها فهنا مثلا في الصورة ديت في immediate type of hypersensitivity reaction of type 1 in the form of facial mean. هنا برضه في immediate type of hypersensitivity reaction of type 1 بس في الأورال cavity in the form of area of erythema. ساعات بيشبهوها بتيستينج عاملة زي قرصة النحلة كده. هنا برضه في urticaria resulting from the use of non-steroidal anti-inflammatory drugs. هنا برضه في angiolytic edema of an allergic reaction to intramuscular administration of the penicillin. وهنا ده المفروض after 48 hours after therapy with epinephrine and antihistaminic agent. في كمان هنا immediate type of hypersensitivity reaction ولكن للبنسلين بس في الأورال كافيتي. هنا بس delay type of hypersensitivity reaction from thiazide. هنا برضه delay type of hypersensitivity reaction نتيجة لللاتكس allergy أو هنا برضه نتيجة في الأورال كافيتي على البلد نتيجة للبنسوكاين. وهنا كمان في type 4 أو delayed hypersensitivity reaction من الأمالجم أو الألاي contact present. هنا برضه في another form of hypersensitivity reaction اللي هي البلازما cell gingivitis اللي احنا كنا خدناها في الgingival enlargement وقلنا إن هي بتعمل diffuse erythema edema gingiva وبتبقى affecting the gingiva بحيث الانترلينزال بابيلا gingiva margin attach الgingiva وبتبقى كمان associated with cystitis and cheilitis. كده unwanted effect to the drug ومن أهمهم طبعا unwanted effects to the local anesthetic agent. فالمفروض local anesthetic agent ديت المفروض إن هي بيبقى فيه two basic types of local anesthetics based on their chemical structure. في اللي هو الإيستر type والأنالايد type. إيستر type زي البروكين الأميثوكين والبنزوكين والأنالايد type اللي هو الليدوكاين والبروكاين والميثوكاين. If the patient is known to be hypersensitive to certain local anesthetic with based on the para-aminobenzoic acid زي مثلا البروكاين ففي الحالة ديت it's must that such patient would show cross hypersensitivity to any other local anesthetic agent based on the para-aminobenzoic acid زي مثلا الميثوكاين. On the other hand such patient would not probably show cross hypersensitivity to the lignocaine or prenocaine because these compounds are not derivatives of para-aminobenzoic acid. بالنسبة للunwanted effects to the local anesthetics في unwanted effects due to the local anesthetic agent وفي unwanted effect not due to local anesthetic. unwanted effect due to local anesthetic agent ممكن unwanted effect ده يحصل في normal individual or abnormal individual. في normal individual ممكن بيحصل فيه stimulation or depression of the central nervous system أو ممكن يحصل برضو cardiovascular system affecting cerebral cortex medulla أو يحصل direct action on the heart cardiac arrest أو ممكن يبقى في action on the vascular bed أو اللي هو peripheral vascular collapse. وبالنسبة في abnormal individual ممكن يبقى فيه بقى allergy or hypersensitivity ممكن يبقى فيه intolerance أو ممكن يبقى فيه idiosyncrasy bizarre reaction. ده بالنسبة لل unwanted effect due to local anesthetic agent. بالنسبة لل unwanted effect not due to local anesthetic ممكن يبقى فيه psychomotor or vasopressor effect. And from time to time the administration of local anesthetic is followed by some unfavorable response of the patient. It appears that the majority of the adverse reactions are due to overdose with local overdosage with local anesthetic rather than due to other causes. بالنسبة للأفكت and central nervous system, all local anesthetics are potentially central stimulants, and this may produce excitement, confusion, or frank euphoria. ممكن كمان يبقى في apprehension. So patient may complain of headache, tinnitus, nausea, or feeling of coolness. At this stage, may be followed by muscle twitching and convulsions, and the later is controlled by near convulsions with mouth switching, yet to be controlled by 50 milligram of 2.5% solution of cyclotone intravenous. CNS stimulation may be followed by CNS depression, and this will lead to fall in the blood pressure with consequent loss of the consciousness and respiratory depression. ولما بيحصل كده أو if this occurs, it will be necessary to start artificial respiration and to administrate the vasopressor drugs زي 5 milligram phenyl intramuscular to maintain the blood pressure. في بعض الأحيان أو occasionally CNS depression occurs from the start من الأول، يعني معنى كده doesn't follow CNS stimulation. وهنا clinical picture begin with sudden collapse due to central depression of the respiratory, vasomotor, and the other centers of the brain. And if it is okay, put the patient flat with his head down. تعمل artificial respiration and cardiac massage if needed. Well, oxygen administration is very important factor in the treatment of this situation. بالنسبة للeffect on cardiovascular system, if the local anesthetic accidentally reaches the bloodstream, it may cause cardiac arrest due to the direct present action of the drug on the heart and on the conduction system or condition system. المفروض if this occurs, it's vital to perform external cardiac massage combined with artificial respiration immediately. المفروض كمان on the other hand, local anesthetic which injected injected into the vein may be distributed into the body, and its effects are exerted only on the peripheral vasculature, and when this happens, the clinical picture will be one of the peripheral vascular collapse, and also may require administration of the vasopressor drug, lower epinephrine or adrenaline, to restore the blood pressure. ده المفروض اللي هو unwanted effects of local anesthetic agent in the normal individual. زي ما قلنا بتأثر على central nervous system سواء كان stimulation or depression، وبتأثر على cardiovascular system. ممكن يبقى فيه direct action على الهارت يؤدي إلى cardiac arrest، أو يبقى فيه action على vascular bed أو بيحصل peripheral vascular collapse. نيجي لل unwanted effect due to local anesthetic agent مش في النورمال individual بقى في الابنورمال individual، فممكن بيحصل hypersensitivity in certain individuals. The administration of the local anesthetic agent is followed rapidly by anaphylactic shock or after latency of minutes or hours by asthma, urticaria, or angiogenetic edema اللي احنا قلناهم. And the majority of the hypersensitivity reaction are produced with protein or drugs related chemically to the protein. And by contrast, limonene, which is now widely used, appear to be remarkably safe. كمان ممكن يحصل contact dermatitis due to application of ointment containing local anesthetic agent or due to constant handling administering of these drugs by the dentist. كمان contact dermatitis بتحصل دي بتبقى is an example of the delayed type of hypersensitivity reaction. في حاجة كمان ممكن تحصل غير الهايبرسنسيتي بنقول عليها اسمها intolerance. Intolerance means the low threshold to the normal pharmacological agent of drug. The dose required to produce the desired effect is in an intolerant patient is less than the normal dose. يعني patient ده بيحصل له response to the drug بدوز أقل من النورمال دوز. عشان كده بنقول عليه no threshold to the normal pharmacological action of the drug. وبالتالي هنا just a free small dose of local anesthetic agent is followed by CNS or cardiovascular manifestation اللي احنا قلنا عليها بقى، سواء كان بيأثر على ال CNS stimulation أو depression والcardiovascular system، سواء كان direct action on the heart or the peripheral vasculature. في كمان عندنا حاجة اسمها idiosyncrasy. والidiosyncrasy بتبقى means qualitatively abnormal reaction to the drug which is due to genetic abnormality of the individual showing the response. يعني في حاجة هنا مشكلة genetic عند البيشنت ما بتخلوش يقدر يستحمل الدراج دوت، فهي بتبقى very rare reaction of bizarre nature which cannot be explained by any non-mechanism. ممكن يبقى فيه nausea, vomiting and other unusual symptoms. ده المهم قوي ان احنا نبقى عارفين ايه الفرق ما بين كلمة hypersensitivity، ما بين idiosyncrasy، ما بين intolerance. دي بعد كده unwanted effect not due to local anesthetic agent، واللي هو المفروض يبقى السايكوموتور افكت والفازوبريشر افكت. السايكوموتور افكت المفروض includes patient who faint at the sight of needle or whose psychological reaction is abnormal and may take the form of hysterical behavior and there is كده كده and the situation calls for sympathetic sympathetic is management. يعني sympathetic يعني ان انت تبقى so kind مع البيشنت وتتعامل معاه يعني بطيبة شوية وكده، لكن firm handling with the patient، يعني عليه sympathetic and firm handling. والمفروض difficult cases may require appropriate sedation. تدي البيشنت بقى sedative أو tranquilizer قبلها. بالنسبة للvasopressor effect يبقى addition of the vasoconstrictor substance such as adrenaline noradrenaline to the local anesthetic solution may produce local or general unwanted effect. ففي local adverse effect وده بيبقى include a change from initial vasoconstriction with pallor to local cyanosis accompanied by local reduction in the oxygen tension, and this state may be followed by reactive hyperemia which may increase the risk of the post-operative bleeding. وفي general adverse effect due to the adrenaline including يبقى في tachycardia or palpitation، يبقى في rise in the blood pressure which may be dangerous in patient with cardiovascular disease. And in this situation reassurance of the patient may be all that is required except مع ممكن في بعض الحالات البيشنت بيحتاج إلى إن هو ياخد سيمتولامين 5 ملي جرام intramuscular or intravenous. عشان كده dentist or dental surgeon should be aware of the following: excessive use of topical anesthetic preparation, particularly the lozenge, may lead to dangerous degree of anesthesia of the oropharynx with consequent inhalation of food into the respiratory tract during eating. فبالتالي ما يستعملش أو ما يخليش البيشنت بتاعه يستعمل كميات كبيرة من اللوزنجين اللي هي فيها الأنستيك ايجنت، لأن ده ممكن يعمل أنستيزيا fluorophant. كمان the prolonged use of topical local anesthetic preparation carries the risk of inducing hypersensitivity. Subsequent exposure of the patient to the same or chemically related local anesthetic agent may lead to hypersensitivity response, including the possibility of anaphylactic shock. كمان اللي هي topical preparation of local anesthetic may be used to facilitate the subsequent injection of the anesthetic material, ولكن هنا في risk of producing unwanted effect due to the overdose, which may be considerable when local anesthetic are topically applied. يا دكاترة، في حد عنده استفسار؟ دكاترة؟
شكرا يا دكتور.
خير.
شكرا يا دكتور.